Once again, good morning to one and all. Today's topic of interest is school dental health program. So we'll be looking into what is the significance of school dental, why we need to focus on schools, why dental only. Okay. So those programs, what is the need for a school dental program? What are the uh, requirements for a school dental program? What are the activities that can be done? Uh, what are the programs which have been established in India and across India? What are the programs which have been implemented in the school? That is what we'll be looking into. So to start with, okay, we'll be looking into so the contents of the this presentation would include the introduction, brief introduction, and who is responsible for this oral health. Okay, why school, the justification, aspects of school health services, the objectives, ideal requirements, the advantages, okay, models, the different models and examples, and the references. Okay, to start with, introduction. Children who suffer from poor oral health are 12 times more likely to have more restricted activity days, including missing school, than those who do not. However, in India, in Kerala, to be specific, okay, we have already achieved 100% literacy rate, okay, that to primary literacy rate, okay. These are all the areas where more of dental activities leads to loss of school hours. They used to take permission from the schools and report to a dental hospital or a dental clinic or even to our colleges. Okay, and approximately more than 50 million hours annually are lost from school due to these oral diseases. Either it could be a form of dental caries, or it could be periodontal disease, or it could be some trauma, or it could be some orthodontic need, okay, correction of malocclusion or whatever it is. Okay. So while tooth decay and gum disease are among the most prevalent, whereas in case of orthodontic need or trauma comparatively are less, because now with the increase in the knowledge they are seeking remedies for dental trauma as well as also for orthodontic treatment need. Okay, why school? In school, oral health education is cost effective. Why? Okay, let's see in Indian scenario. On an average, the DMFT of a child would be 4.5. The total population of in India is, as far as earlier this thing was done at that time, at that point of time, it was 900 million. The child population in the 900 million, that is 40 percentage of adult population, that is 360 million. So if I need to restore one filling, then the cost of one filling would be rupees 50. Okay, on an average, okay, a kid would be having a 4.5 DMFT. So if every child needs at least one filling, which costs rupees 50, which accounts almost 18 billion rupees would be spent just for restoring it. Okay, but if I had properly invested, if I had properly strategically planned all these activities, I could have prevented this event from happening. So how could we prevent it? The best way is through school welfare program. The World Bank analysis in 1993 said that the world could benefit by implementing an essential public health package. Essential public health package in the sense, okay, it could be essential or the basic public health package, which could package which could enable the people to take health, or to be specific, oral health into their own hands rather than a dentist coming and restoring the tooth. Okay, they could have prevented the disease early in the life. What are the five elements? Okay, so the essential package which was put forth by the World Bank analysis in 1993 said that an expanded program on immunization, school health programs, programs to increase public knowledge, programs to reduce consumption of alcohol, tobacco, drug use, and AIDS prevention program. Okay, so I would say if all these things were targeted, all these programs were targeted, okay, towards a specific population. If it is a children population, it would be more cost effective. So where would I do it? The best way to is implement is the school health program. A better oral health improves the academic performances also. So, for example, in California, by third grade, 71% of the students had dental decay, with almost 29% having untreated decay. And students tend to miss an estimated 8,74,000 school days annually due to oral health problems. And the premature loss of deciduous teeth may lead to malalignment of this permanent teeth, okay, impacting on individual appearance, okay, which also might we need extensive treatment to correct the malalignment, seeking the help of an orthodontist, which would be comparatively higher. The cost of a filling just would be 50 rupees, but while as in comparing to orthodontic treatment, as far as in India, is comparatively not in just, which is not going to restrict within just 50 rupees. 500? No. 5,000? Maybe. So that is the significance of school program. Importantly, tooth loss can affect children's nutritional intake and consequently affect their growth and development also. The nutrition also has a direct effect on children's oral health also. It's vice versa. So oral health is who's responsible? Is it the state responsible? Is it the national responsibility, or is it an international responsibility? Over the international responsibility, the WHO has put forth everything. It is the nation's responsibility to implement statewide programs, not only health programs but also specific oral health programs to promote oral health, to help people take control over and improve their health through promoting the conditions that allow all its members to attain health. The school is the best setting. Using the structures and the systems already in place, a school is an effective setting for the promotion of oral health. Initiatives that adopt the strategies are effective, long term cost saving, health promoting strategies. Integration of oral health in health promoting schools. So, what are these health promoting schools? Okay. Say, for example, any schools, okay, if you say you can just have an example, health promoting schools, when we speak about it, we need to divide it to urban and rural area. Okay. So, in a urban area, you could see more, you can see different kind of scenario. In urban area, you can see more of delicate as well as in case of rural area children, you can see a more of periodontal trauma, those things and all. Because probably this could be related to the health-seeking behavior of the parents as well as the childrens. In case of urban area, they have more access towards chocolates and other confectionaries, which are promoting more of delicacies in case of urban children. Whereas in case of rural children, okay, they have no access to oral health products, say for example, toothbrush or whatever it is. So this could, or they may not be having the knowledge of twice brushing or whatever it is. That also could lead to these discrimination between the urban and rural divide. The school health program is an important aspect of a community health program. It is an economical, powerful mean of raising community health in future generations. In 1909, medical examination of school children was first carried out in Baroda in India. In 1953, the Secondary Education Committee emphasized that the need for school nutrition programs, okay, which comparative would improve the health condition. So in those days, in 1950s and all, the nutrition was a major problem. The health was more seed out problem. That was the need of the town. Okay. Now the nutrition program is comparatively good among urban, okay, and comparatively less in rural India. 1960, the government of India constituted a school health committee and submitted its report in 1961. In January 1982, a task was constituted by the government of India to propose an intensive school health service projects. Coming to the going outside India, the Tokyo Declaration was made on July 19, 2001, at the first Asian Conference on Oral Health Promotion for School. This is where, at the international level, oral health considered to be an was considered to be an important scenario where oral health promotion should be targeted to school children, which came late back in 2001. The Ayutthaya Declaration was made on February 23rd, 2003 at the Second Asian Conference of Oral Health Promotion for Children. The Bangalore Declaration was made on January 28th at CMHAD workshop, WHO workshop on prevention and promotion of oral health through schools. So, what is this school health services? How could we achieve it? So, let's define it. The school health services are defined as a procedure established to appraise the health status of a pupil and school personnel, to counsel pupil, parents, and others concerning the appraisal findings, to encourage the corrections of remediable defects, and to assist the identification and education of handicapped children, to help control and prevent disease, to provide emergency services for injured. So these were all the procedures which were established by the Committee on Terminology of American Association for Health, Physical Education and Recreation in the year 1951. Let's look into what are the aspects of school health services, how you could achieve these things. Okay, first one is health appraisal. It's a process of determining the total health status of a child through health histories, teachers, nurses, observations, screening test, medical, dental, and psychological examination. Okay, just you need to assess what are the problem. You just need to observe what is happening. Okay, what is the status? Nutritional. You can take the height, weight, BMI, you just can screen for the oral diseases, or you can look into any other anemic conditions or whatever it is. That is health appraisal. Next is health counseling. If you find anything, okay, so as a preventive thing, say if you find any anemic conditions, you could necessarily you can do some remedies to prevent further problems. You can look in for, okay, any disabilities, okay, hearing impairment or whatever it is. So health counseling, it is a procedure by which a nurse, teacher, physician interprets pupils and parents the nature and significance of health problem and aid them in solution of the problem. Emergency care and first aid. Teacher should be trained in handling simple emergencies such as traumatic injuries. Okay, and also these health education, and also you can during while playing most of the time, okay, during your school hours probably you would have got hurt during your physical education time. So that is the best place you could have prevent. So the physical education trainer probably could be handling this type of trauma injuries. Okay, school health education is also an important way by how you could promote good, good lifestyle practices. It is a process of providing learning experience for the purpose of influencing knowledge, attitudes, or conduct relating to individual as well as for the community. Also, maintenance of school health records. These records are useful in analyzing and evaluating school health programs. And curative services also could be given to the school children's by regular visits or regular dental checkups or medical checkups and prompt treatment then and there, and the referral for special care. Say for example, if they require a higher thing, okay, they could be referred from there itself. So by this you could increase uh, the capacity of the forthcoming generations. So what are the objectives of these things? It is the objectives of school health program is to help the child acknowledge the importance of healthy mouth, to make the child understand the relationship of dental health to general health and appearance, to teach the importance of dental health practices including personal care, professional care, proper diet, and oral habits, to include all the groups and agencies interested in the promotion of school health, to make the dentist perform the school health activities. The ideal requirements would be, okay, a school health program should largely focus on to be administratively sound, be available to all children, that is equality in access and equity in delivering any health services, provide the fact about dentistry, dental care, and especially about self-care procedures, aid in the development of favorable attitudes towards dental health, include primary preventive dentistry programs, and improve the psychomotor skills like toothbrushing and flossing, and having the practices early in the life itself. Okay, provide screening methods for early identification and referral for services. What are the advantages? School-based dental health programs bring a comprehensive dental care, including preventive measures to school children. Students can access during their formative years from childhood to adolescence. School clinics are less threatening than private offices since children are used to those kind of surroundings. So you could reduce anxiety. If the children can be maintained a state of good health, good dental health to be specific, it will be easy to maintain their dental health in their adult life. Regular dental attendance pattern in early life can be continued even after the school age even after the school age as an adult also. The expenses and the time can be saved when the child gets dental care in the school itself. Complicated dental auxiliaries aren't needed. Okay? You can just educate the teacher or you can just provide a dental health nurse. Health of the school staff, families and communities can be enhanced by the school programs also. Let's see what are the elements or components of school dental health program. The first is improving school community relationship, that is the relationship between the parents, teachers, and the administration, okay, including the child, okay, with the health department. To be more specific, any general health as well as dentists. Conducting dental inspection serves as a basis for school dental health instructions to build positive attitude in child towards the dentist and dental care, and also provides information to plan a sound dental health treatment. School dental health programs aims in teaching dental health in the classroom itself. The dentist serves as an expert resource person to strengthen the teachers' classroom instruction programs and also motivates the children's motivates the children to take up this kind of practices also, or they might be motivated to take up dentistry as a profession also, and perform specific programs like toothbrushing, hand washing, uh, then flossing program, fluoride mouth rinsing program, fluoride tablet, okay, school water fluoridation program. Okay, however, all these things have their own pros respectively. Nutrition is a part of school preventive dentistry program. School lunch programs are designed to permit the child with the intake of nutrients that approximates one third of their daily intake of essential carbohydrate, where they spend almost like 12 hours, 10 to 12 hours, minimum 8 to 12 hours of school time, and where they have the most of the time and where they eat in the schools. Students are advised to reduce the frequency of sugar intake and rapid clearing of mouth after consumption. Midday meal program is a nutrition program which was after the Ayutthaya Declaration in 2001. It started in 2003, which was implemented first in the state of Tamil Nadu. A midday meal program was initiated. It was not in 2002, it was way before that. First, on a trial, it was implemented in Tamil Nadu during the period of Kamarajan and M.G. Ramachandran. The objectives of this program was to improve the enrollment and attendance, where the school attendance was comparatively less, and the literacy rate was comparatively less, in order to increase the school attendance and the improve the uh, literacy rate. The government came up with the idea of introducing midday meal. At least the parents would say, at least my child would get at least one meal at least a day. So that was the main aim of this program. However, it had improved the school attendance as well as the literacy rate as well as the nutrition. So it was a win-win situation. The objective was to improve the enrollment and attendance, to reduce school dropouts, to improve child health, and to improve learning levels of children. Even now, this midday meal program has been adopted or sustained in India. Was there the seal and placement program? Seal and placement with fluoride application helps to prevent this teeth and fissure lesions, which is most, which accounts the most common class 1 lesion, dental caries, that could be prevented with the help of seal placement. And to improve or to promote good health and oral health, you can we can plan on science fairs to help build a growing reservoir of students who may sometimes choose a dentistry as a career. It also helps in motivating, educating school children to improve their oral health. And finally, the referral for dental care. Parents should also be informed about their children's dental treatment given at the school and to consult other doctor if in case of any emergencies. Already, say for example, in an urban area, the children would be already under the treatment of some dentist. So what you can do, what can be done is health appraisal can be done. You can make a note of whatever uh, caries experience or periodontal or any lesions or trauma, whatever it is. You can make a note of it, give it to the teacher, and the teacher would be attaching probably with the school diary and asking the parents to do necessary treatment based on their capacity. This is called as a blanket referral. Here, all students are given a referral cards to take home and then to dentist who signs the card upon completion of the treatment and report back to the class teacher. Next is follow-up. A periodic follow-up should be done after initial treatment to make a caries-free oral cavity. So let's come into what are some of the school programs which are widely implemented. Learning about your oral health, a prevention oriented school program. Tattle tooth program, that is Texas statewide preventive dentistry program, which was implemented between 1974 to 1976. The Tattle tooth program 2 was developed in the year 1989 to cover 3 million school children. However, initially it was covered only up till this much of people, like 90,000 children. In addition to those Tattle program, another SHE school health education evaluation program was also developed in 1993. Super brush program for school preschool children also were implemented. Third is Ascover dental demonstration from 1949 to 1957 is a small farming community with more caries prevalence. The school program, okay, had benefited them except for community water fluoridation since until 1955 as it had no community water supply. The school demonstrated a public or school water fluoridation, came up with this pioneer project. Next is the North Carolina statewide preventive dental health program, which was implemented in 1918. The objectives were appropriate use of fluoride, health education in schools and communities, availability of public health dental staff in all counts. So the highlight of this program was it was a public-private partnership program. Later on, 1965, the Head Start preschool dental program was implemented in the United States. SHARP, that is School Health Additional Referral Programs, was also initiated. Then the Teenage TETA, that is Teenage Health Education Teaching Assistant Program to give the knowledge and skills to the young children allows high school children to develop understanding of young children's, okay, and to introduce them to career opportunities. And this is the most widely or which can also be seen in India. Colgate Bright Smile Bright Future. It was developed to teach children positive oral habits of basic hygiene, diet, and physical activity. So these are all the other successful oral health programs all over the world. Manchester's two-time Montana, Washington State, Colorado, Oregon, Malaysia, Japan, Philippines, Kuwait, even Pakistan has a school oral health program. Brush Day and Night, Nigeria. So these are all the school health programs. Let's look into what are the limitations. Some school inspections tend to discourage rather than promote the development of habit visiting to the dentist at an early age. It is desirable for the parents to be present during the examination for ethical concerns. Parents and children frequently accept the inspections to be comprehensive rather than incremental. These are all the major limitations of school health program. However, the comprehensive dental care means, okay, it is the meeting of accumulated dental needs and the time population group is taken into the program and the correction of new increment of dental disease on a periodic basis. Services are provided to restore serviceable teeth to good functional form and replace the missing teeth. Whereas in case of incremental care, it is defined as a periodic care so space that the increments of the dental disease are treated at the earliest time, consistent with the proper diagnosis and operating efficiency, in such a way that there are no accumulated dental needs beyond the minimum. So in private practices, 6 months is the commonest period for incremental dental care. So, what are the advantages? These are all the advantages and disadvantages. Dental caries are treated before pulpal environment. Periodontal diseases are treated at the beginning. Preventive measures are maintained at the periodic basis. Bills for the dental services are equalized and regularly spaced, which is cost effective. What are the disadvantages? It is time consuming and it focuses only on the attention to deciduous teeth. But if you are focusing on health promotion, it will also benefit the adult teeth, also increasing the likelihood of interruption in children's dental health programs, which would have a negative impact to meet a dentist in their future. So that is all about school oral health program. To conclude, the school dental health program should not impose an excess or unusual teaching burden to the teachers. It should be cost effective in manpower, money, and material, and it should produce observable results. Thank you for patient hearing. So the references for my presentation is from Suvan Peter, WHO, and other materials. Thank you for patient hearing.